In traditional medicine, most physicians at most have 5 conference days, or what we call CMEs, per year. Unfortunately, that is not conducive to staying up to date on everything that you need to stay up to date with, because medicine is constantly evolving and changing, especially in the industries that we're in. We've already probably been to 7, if he's probably been to more than that this year alone. So that's what, 20 days, maybe more. I don't know exactly. So we're still in May, and we have another one coming up in a couple weeks, and then there's another one after that. So every month or every 4 to 5 weeks, there's a conference. A lot of the times they're front loaded at the beginning of the year, and each of them provide a unique sense of information. And most of the time they don't interact really at all. They are completely separate and independent. And unfortunately, they do get expensive and they take away from time with patients and with clinic, but they are invaluable in a way that is hard to fathom. And you want someone that's up to date, that understands the changing environment in medicine, wants the new cool data, and wants to be data driven. Nowadays, traditional medicine is so busy with busy work and 20, 30, 40 patients a day. There's no way the physicians have time to read these studies, to go to these conferences, to interact with fellow peers that are also doing this, that are not in their same facility. This is a place that you can do that. Unfortunately, if you're in traditional medicine, it's very difficult to do that. We have the luxury of being able to do that here.
Ever since I started, I realized that in order to get the in-depth information, we've got to keep learning it every year. Be around the individuals that have done this for decades. 2 of my mentors were doing these things from the 1970s. Of course, they're not in practice anymore, but we've got to keep that legacy going and keep knowledge. I never think that I know everything. I want to learn. I want to be around people. We teach at some conferences, we learn at others. We want to help grow the field in a positive manner and get our information out there. Being able to work together as a team is the key. We're always smarter with other people involved and to bounce ideas off of. This year, Dr. Morse has given talks at a stem cell conference. I've given talks at a prolotherapy regenerative medicine conference. We've both been teaching at these conferences with ultrasound, with injection technique. We're getting ready to talk at another conference in a few weeks called Cell Surgical Network. Just attended an ozone conference where we got to see some of the craziest case studies of people getting better. We are going to be integrating this within our practice, and that knowledge collectively is going to make our practice better and give us better care for you.